Hello, Lively. This is Coach Wilson, your health teacher, and we are going to go over some dental hygiene today. Let's get going. All right, so now before we begin, I want to just kind of go over a quick assessment to see what you already know. How many sets of teeth do you get in your lifetime? Do you think 1, 2, 3, or 4? This means if you were to lose your teeth and some grow back, that would be a second set. How many sets do you get? If you're thinking 2, then you are correct. We have 2 sets of teeth during our lifetime. Deciduous teeth. Deciduous means shedding, so we lose them. And permanent teeth, which means they're going to stay there for the rest of your life. Granted, you take care of them and they do not fall out or you remove them. Why do we have teeth? How many do we have? These are some questions that we would go over in our Zoom. Why do we have teeth? So let's think. The most obvious reason would be to chew our food, maybe to have a pretty smile, but maybe the unobvious choice would be to talk. We use our teeth so we can pronounce things and say words, and if we didn't have our teeth, we would sound a lot different. Now, how many teeth do we have? So when we're a kid, we do not have all 32, but we are growing up to get to our permanent set, which would be 32 teeth. We have 4 incisors on the top, 4 on the bottom, and then we have 4 canines and 12 molars. So this next screen is talking about the 32 teeth. If you said 32, then you got it correct. And you should have your full set of teeth by the time you're a teenager. So the parts of the mouth that you want to think about in this slide is your tongue, your mouth, your gums, and your teeth. And now these are the teeth I was talking about, the different kind that you have. You have 8 incisors, which are used to cut. So on your screen, you can see they're the top ones right here, and the bottom ones in the front, 4 and 4. Then you also have your canines. They are the 2 that kind of bookend the incisors, and they have fangs. They're known as the canines because if you think of a canine, canine is another name for dog. Dogs have a lot of sharp fang-like teeth. Then you have 12 molars, which right here, you have 3 back here, 3 back here, 3 and 3 on the bottom, which makes for a total of 12. Now some people have 12, but some also have more or they have less, just depending on how their teeth grow in. And those are in the back are called wisdom teeth. So which teeth help us to chew, tear, cut, and grind? Well, we use all 3 for different purposes. The front we use to cut, kind of put our pieces into smaller pieces. And then the ones that are like canines, you could think of a dog like tearing through some steak. Those are what we use them for. And then the ones in the back, we use them to grind. That way it can be small enough where we can swallow. Alright, so now I'm going to label the different types of teeth. Right here I've already started with yellow. This is going to be labeling the incisors. And then I would also type in yellow, incisors. And then I would move them close to the front. Then I would have the canines being labeled. I would get to highlight. Right here you kind of see they're pointy and they're fang-like. And then these are pointy at the bottom as well. These are used to tear, right? So then I would type in red, canines. Okay, and that would kind of help us think of that. And then right here, we're going to do the last ones. How about green? And I'm going to just highlight the last ones in green just to give you a visual of what is what. Okay, Sometimes your wisdom teeth, these molars right here, grow in and they're called impacted. Impacted teeth are inside the gums, and you have to have those surgically removed if you don't want to you don't want them to mess up your teeth. So there's the three parts: incisors, canines, and molars. Alright, so right now I'm going to show you a quick little video on how to brush your teeth.
How to brush your teeth. This will only take a few minutes each day, but will help keep your teeth and gums healthy. Brushing helps to remove the plaque that forms on your teeth every day. If the plaque is not removed, it forms acid. This causes teeth to decay and gums to become infected. When brushing your teeth, it is a good idea to use a brush with soft bristles, which is gentle on your gums. First, brush the chewing surface of your teeth with a back and forth motion to remove food particles. Next, gently brush your teeth in a circular motion with the bristles at a 45-degree angle towards the gum. Do the same on the inner surfaces of your upper teeth. Then repeat these same steps on your lower teeth. After brushing, rinse your mouth and check to see if you've missed any places. Remember to take time to brush and floss your teeth properly every day.
Now it's going to go over how to floss.
Floss. Proper brushing and flossing is important for maintaining healthy teeth and gums. This will take a few minutes each day, but will help keep your teeth and gums healthy. Flossing helps to remove the plaque that forms on your teeth every day. Flossing removes plaque where a toothbrush cannot reach. These areas are along the gum line and between your teeth. If the plaque is not removed, it forms acid. This causes teeth to decay and gums to become infected. To floss your teeth, start by taking about 12 inches of floss. Slide the floss between your teeth, curving around each tooth, making a C shape. Make 3 scoops on each side of every tooth, going slightly under the gum line. Repeat this process with the lower teeth. Don't forget to floss behind your back teeth. Remember to take time to brush and floss your teeth properly every day to keep your teeth and gums healthy.
All right, so we're going to have a question. Think to yourself, why is it so important to floss your teeth daily? So you would come in here and you would think of a full sentence, and I would say, I believe, or you could say, I think, or it is important to floss your teeth daily so you can remove all food and plaque that causes tooth decay and that keyword cavities. So a little quick quiz to see if you've gotten it all figured out. Blank forms daily on our teeth, which, if not removed, can cause tooth decay and infection. So is it molar, floss, or plaque? All right, if you guessed plaque, you are correct. Question number 2. It is recommended to use a toothbrush with soft or hard bristles. All right, this is very important because if you are brushing too hard or the bristles are too hard, it could damage or cause your teeth to bleed while you're brushing them. So you would need soft. All right, a little visual. This picture right here is a picture of a cavity. A cavity is where the tooth decay has come off and there's kind of a hole There's space in between your teeth, and it can come off as black or red, different tints, and that is what a cavity is or looks like. And plaque is a colorless, sticky film of bacteria that constantly forms on your teeth, and this is the main cause of tooth decay. Plaque can come off as looking at like yellow, sometimes because it can take the form or the color of the food that you are eating. So sometimes if you are drinking a red drink, you might have a little bit of a red tint to your teeth if you have a lot of plaque. So how do we prevent cavities? It's okay if you do have some teeth issues, but you can reverse it if you take care of your teeth by using fluoride. Fluoride is in your toothpaste. It's also in tap water through the city. Also, if you brush your teeth 3 times a day. It's not always possible to do 3 times a day if you're at school, so we recommend for sure in the morning before you go to school and at nighttime before you go to bed. And also flossing daily. The last thing it says, avoid sugary foods and drinks, especially after your nighttime brushing. You do not want to go to bed with a mouthful of sugar. So here it is, the last 5 questions to see if you've definitely got this down. Which set of teeth is the first to come in? Deciduous teeth or permanent? Well, considering it says permanent, it's probably not going to be your first set since you lose your baby teeth. So it would be deciduous. Deciduous comes in first. How many permanent teeth does an adult have? Okay, so we know it's in the 30s range. If you are thinking 32, you are correct. 32 adult teeth. Which type of teeth are used for tearing food and looks like fangs? Keyword fangs, kind of look like a dog's teeth. Hint, hint. Canine. These are the ones that are used for tearing. Question number 4. Which of these statements is correct? Plaque causes tooth decay or tooth decay causes plaque? So basically, which one comes first? Well, you have this every day, it says, so what comes first is plaque. And then, if you don't get rid of it, it can lead up to tooth decay. Last question. A cavity is A, the space inside a tooth that remains once tooth decay is removed, or B, a colorless sticky film of bacteria that constantly forms on teeth. So we kind of just piggybacked on the last question. So if you're paying attention, a cavity is space. It's also sometimes referred to as holes in your teeth. It's not super literal. It doesn't have to be a circle. It can just be cracks in the bottom when the tooth kind of goes away. So thank you guys. I appreciate you guys taking the time to learn about your teeth. I hope this information helps you, and I'm looking forward to having you in health for the rest of this year. We're going to continue to learn about things that keep you healthy. So if you have any questions, just email me, and I hope you have a great day. Bye.